Hello guys, I am going to talk to you today about the art of the aesthetic dental consultation. So we're going to talk about teeth, skin, face, assessing all of this for your patient in the one consultation. My name is Dr. Manrina Rhode. This is a picture of me. I have my Instagram handle is at Dr. Manrina Rhode. I love my Instagram page. I'm really active on it. If you have any questions for me regarding today's consultation, feel free to DM me on there. And yeah, let's have a conversation. I hope you find today's information really interesting. I'm excited about sharing with you my thoughts on doing this comprehensive, holistic approach to an aesthetic consultation. The aims and objectives of today's talk. So we're going to do an overview of the aesthetic consultation. We're going to talk about how to assess patients' personalities. That's a really important part of aesthetics. It's not one size fits all. And also how to bring these treatment plans together. So it's all good and well assessing teeth and skin and face, but how do you bring that together to a single treatment plan and then give that to your patient? So let's look at that in the next hour or so. So, patient comes into your room. This is your first interaction with the patient. Actually, to be fair, these days there may have been a Zoom call beforehand, but assuming there wasn't and the patient's booked in, this is the first time you're meeting them, or even if there was, it's really important that that patient has a great first impression of you. You want them to feel really comfortable. You want them to trust you, to know that you're friendly, to not be nervous and not be scared, and be able to want to go through this appointment with you. People by people. So the treatments that you're offering, there's probably many clinicians in the country that are also offering similar treatments. The reason a patient will go ahead with a treatment plan like this with you rather than someone else is because they're buying from you. So really, this is your chance. This is the first impression. They say that first impression is formed in the first few seconds. So when the patient comes in, give them a big smile. Back in the day, we would have shook their hand. Maybe that's not something that's as appropriate to do these days. But certainly let them know that you're happy that they're here, make them feel comfortable, make sure they're settled comfortably in their seat. And it's really important that none of that feels rushed, that they come in, they see you, they meet you, you put their things down, get them comfortable, make sure they're all set up, set yourself up in a position where you're sat comfortably, where they're not sort of turning their head to look at you, but they're looking directly at you, sitting comfortably, and you're in a relaxed position as well, as if there's no rush. You're sat there, you're ready to talk. And I think that's a really important part of aesthetics. This isn't like a quick in, quick out type procedure. This is no procedure should be like that, but definitely at this initial consultation, it has to feel very relaxed and very open, like friends talking about something. They can be open with you. They can tell you how they're feeling, and that you want to listen. Before you start, train up your nurse so that your nurse is writing down everything that's discussed. So in my new patient consultation pro forma, I have a part that says nurse's name and nurse's notes. It's really useful to know which nurse was in the room with you. Maybe that day you don't have your regular nurse, maybe you've got a temp, maybe you've got someone else working with you. And if you ever wanted to refer back to who else was in the room, if you weren't sure about something or you couldn't remember something, it's really good to have a note about who was there. So I have the nurse's name. Nurse will go to the computer, write nurse's name, and then I have a nurse's note section. Now, this nurse's note section does not need to be written perfectly. Tell your nurse you don't care about spelling, you don't care about if her missing words out. You just want her to type. So while you and the patient are having this really relaxed chat, the nurse in the background is typing everything down that the patient is saying, and that way you've got this big blurb of notes to refer back to later on when you're writing up this quite comprehensive plan. There's a lot you're going to go through with the patient today, and so or at this consultation, and so it's really important that there's lots of notes and it's all written down so you can get your head around it when you're then creating this comprehensive treatment plan. So that's my first tip for you, and it's maybe my second tip. First one, be super friendly when the patient walks in. Don't let them feel rushed. Second one, get your nurse to write down the conversation that you're having. Then once you've got your patient sat there in front of you, you really, really need to listen to them. It's so important that you're not, I know that with me, within like a minute of meeting someone, I assess everything about them. I'm like, oh, I can do this with your teeth and this with your gum and this with your lips, and oh, your features would look better like that. And what skincare are you using? You really need to start using this or doing this. And that's something that automatically happens in my brain when I meet people. But it's not up to us to put what we think the patient should do on the patient at the beginning of the consultation. I think at the end of the consultation, there's no harm in making the patient aware of their options. That's why they've come to you for your expertise. And so it's nice to share that. But at the beginning, it's really important to find out why that patient is there today and what it is that's bothering them. So really, really listen. Ask them, what do they like about themselves? What do they not like about themselves? Probably they're going to start off by telling you what they don't like. I put that at the beginning, saying what do they like, because it's not something that we very often talk about. But I think it's a nice thing to talk about, and also it brings out good emotions and feelings within the patient that they're talking about something that's nice about themselves. Like, oh, I quite like my eyes, but people compliment me on my eyes, and that gives you an opportunity to also make them feel great about their beautiful eyes. So it's not all negative and just talking about, oh, face is sagging, wrinkles, broken teeth, yellow teeth, whatever it is that they're got me smile, whatever it is that their issues or the things that they want to change are. So really nice, long conversation. Take your time, take pauses. Don't let the patients often think we're just really busy and they don't want to take up too much of our time. How many times do patients say to us, like, I don't want to take up too much of your time, doctor. I know you're really busy. And you want them to know that this appointment is different. At this appointment, you've got time. You want to talk to them. You want to listen to them. So sit there, let them talk, listen to what they have to say. When they finish talking, sit silent for a couple of seconds. Don't just interrupt, just in case sometimes, they'll say something, you'll sit silent, then they'll say something more. Patients can feel quite nervous about pointing out things they don't like about themselves. Some of them think it's vain to want to change the way that you look. And so you're dealing with all these psychological issues at this consultation. It's a bit different from a normal pain appointment where someone comes with a problem like a toothache or a skin condition. This is something that's like, they'll be like, oh, I know my teeth aren't that bad, but everyone seems to be straightening them these days. Maybe I could just straighten them. Like, they kind of want to play it down. And, just sit and listen and be open. Make sure you're letting them know that you're hearing what they're saying. Repeat what they've said to you back to them. Say, oh, okay, yeah, so your crowding of your lower teeth is bothering you. When did it start bothering you? Start having a conversation about it, so that so you can really understand what it is, where they're coming from. And maybe also understand the emotion behind what made them decide to come in today. So most probably whatever they're going to come in about has been on their mind for a little while. Why now? Why you? Why are they there? Again, people buy much more into an emotional connection. And so if you can show them that you understand how they're feeling, oh, they've got a wedding coming up, oh, they've been doing a lot of Zoom calls, and they've suddenly realized that there's certain things that they notice that they don't like. During the pandemic, before the pandemic, people would look at themselves for maybe 5 minutes a day, maybe. During the pandemic, people were looking at themselves like 8 hours a day on Zoom. So suddenly, all these things that they had never really looked at their face in that much detail before, and these things all became aware of things they didn't like about their face. So it's been an interesting time, and people may have noticed things, and that could be a reason that they've come in. But it could be an event, it could be a birthday. I find people often come in before their 40th birthday, and so I always have a hashtag about that. But yeah, any of these big birthdays, 30, 40, 50, or just generally in life, maybe it's just time, it's their time. Like they finally feel that they're in a place where they could spend a bit of money on helping themselves look better. And so, who doesn't want to look better? It's never a negative thing. Okay. Once you've really understood why they're there today, what it is that potentially they would like to achieve from the consultation, or from your treatment plan, Then you want to take a comprehensive history of their current regime. Okay, so this is pretty intense, a lot of information. And again, if your nurse can be writing this for you in the background, then that would be great. So you've got a copy of it all. You want to know with their teeth what they're doing. So are they using a manual toothbrush? Are they using an electric toothbrush? Do they floss? What sort of toothpaste are they using? So you've got an idea. Have they whitened before? Do they have whitening gels that they use often? So you've got an idea about who they are. If they kind of come in and say to you, yeah, I electric toothbrush, electric water flosser twice a day, at least twice a day for 2 minutes, and really into my brushing and cleaning, fluoride toothpaste, you kind of know that, okay, their gum health is probably pretty good. They're probably going to be pretty compliant with whatever you ask them to do for maintenance through your program. If equally they come in and say to you, I always brush at night, meaning that they probably only brush once a day, and that, they would say, I use a manual toothbrush, usually at night. They never floss, you've got a bit more work to do. That doesn't mean you can't create a comprehensive plan for them. And that doesn't mean that they can't change, because it's just amazing how many people out there have never been taught how to correctly clean their teeth. And so actually maybe you're just the person that they need, or you send them to your hygienist and get them some really good advice about how to start changing the way they're cleaning at home. Skin, you want to find out what skincare they're using. I think that's shown on my slide here. I think that's always a really interesting conversation. Sometimes with my male clients, they'll say, oh, I just use water. And you're like, oh, wow, you've got real virgin skin that you can start playing with. Sometimes they'll say they use soap or shampoo on their face. And then, and I don't want to stereotype, but with my female clients, often they'll be using something, but it could be anything from like an oil of Olay or a Nivea up to a creme de la mer or Clarins or something in between. And I think that's really interesting. Or perhaps they've got a dermatologist and they're already on medical grade skincare. And it's really good to understand where your patient is on that journey. It also gives you an idea of how much improvement you can give them by changing their skincare. So if their skin doesn't look great, but they're already using a certain level of care, you need to increase that slightly for them. It's unlikely if they're already on medical grade skincare that their skin won't look really good, but there are always other options within medical grade skincare that can be incorporated to change our skin as we go further in life, as new things come about, hyperpigmentation comes about, a bit of sagging and loosening as we get older, and different things that, so your skincare constantly needs to evolve with you. I mean, just as your teeth treatments will throughout your years, so will your skin treatments, and then of course your facial treatments. So there's all those things, the signs of aging, where we lose our bone density, so we lose the really lovely support that we have underneath our skin. Our fat pads drop, our skin loses elasticity, and so it becomes sort of saggy, and all the wonderful things that happen. And I'm not a believer that we all need to look 20. I think that it's nice to embrace the age that you are, but my catchphrase for my brand is be your best you. And so we want to encourage our patients to be the best that they can be, and that can certainly be done with various treatments that are available these days for the face, injectable treatments. So we're talking about Botox and fillers, and different treatments that are out there. So find out how they're cleaning at home with their teeth, find out what they're using on their skin, and find out what they're doing regularly for their face. Do they go for regular facials? Do they have regular injectables already? Have they ever had injectables before? And all these things are really interesting to know. You also want to discuss any previous treatment they've had. So if they have an old crown on their tooth that now has a dark margin or has recession around it or has moved or whatever, of course, they probably already told you the story behind it in that initial conversation. But if they haven't, then make sure at this point you've understood, have they had braces before? What are their thoughts on braces? Why did they have that front tooth crowned? How regular are they with their dental visits? So you've talked about their oral hygiene at home. Are they a regular attender with a dentist and a hygienist? When did they last see their dentist and hygienist? There's so much you want to know about your patient. There's so many questions you want to ask, and there's so much you want to talk to them about. and you want your nurse to be in the background noting this all down for you, because it's all really important, useful stuff that will be part of creating a bespoke treatment plan for your patients. It's not a one size fits all. Different patients have different compliance levels, different levels of understanding, different levels of treatment expectation. And so all these questions will help you tailor the perfect treatment plan for your patient. You want to find out about previous injectables that they've had, if they've had Botox and fillers, if they've had permanent fillers, if resorbable fillers, how long ago was it, where did they have their Botox, how did they find it. You want to find out any previous skin treatments they've had, facials, peels, so you've got a really good idea about what you're dealing with now with the canvas that you now have in front of you. So you've had a really long chat with your patient, and now it's time to actually start looking up close at what's going on. And through them talking, you've got all these ideas in your head, but you really can't confirm things until you have a really good look inside their mouth. We're going to take some really great photography, and then we're going to look at that and start creating a plan. So we're going to complete our dental exam. This whole bit, the dental exam, the aesthetic dental exam, is like an hour-long lecture in itself. So I have this lecture on my course, Designing Smiles. If you would like that to go through the actual dental exam step by step, then please have a look. You can come and learn from me in person, you can learn from me online, and you can check it out on my website, which is on that slide there. But yeah, so you do your comprehensive dental exam, you get all the information that you need so that you can create a cosmetic plan for your patient. And then you sit the patient up. If you need to take any x-rays, you can take those. And then also you will do your photography. Now, we're doing photography for full face assessment as well as dental assessment. So there's a whole series of photos that need to be taken. The facial aesthetics assessment is a series of photos like this. I'm going to go through them in more detail for you. With a dental assessment, there's these pictures which can also be used for the facial aesthetics assessment. Again, for the dental assessment, there's a whole series of smile shots that we need. There's retracted views. I have a studio set up, I take studio pics. It's nice to take beautiful pictures of your patients because if you've got beautiful before and afters, not only can they be quite useful for social media, if your patient gives consent to full face being shown, which is not that often, but when they do, that's really great. And if not, it's just lovely to send these pictures to the patient so they can see their beautiful before and afters. And the more beautiful they are, the more likely they are to share these pictures with their friends and family. And that's sharing your beautiful work. All that's doing is bringing you new lovely clients, similar to the lovely clients you already have. There's no better way to get new clients than a word of mouth referral, because that client's already sold. They already know you're great. They already know their friend who they trust had a great experience with you. So yeah, it's really worth taking time at the beginning to take some really great pictures. We know at the end we want to take great pictures, but it's that before and after. It's allowing patients to see, oh, did I used to look like that? They forget very quickly how they used to look once you start changing and making them look better, which is lovely as well. And then for every patient, you want to take a photo consent. You want to get a photo consent signed. So I like to get this signed at the initial consultation. It gives you an idea about the patient's personality and who they are. If there's someone who says yes to taking video testimonials or having videos taken, great. And if you're someone who is active on social media, and as I told you at the beginning, I'm very active on my page at Dr. Manrina Rhode on Instagram. Then that's great content. That's content creation. It's free, organic content creation that while you're at work, you can just stick your camera on or get your nurse to film, and you can film what's going on with your patient. And how interesting is that for everyone to see what actually happens in your surgery on a day-to-day basis? We don't think it's interesting because we live it every day, but actually it is. People love it. They love seeing that. So if they've ticked full face, great. From the beginning that's really important. If they haven't, if they've said smile only, then okay, you've also got that in your mind. And if they've said no to social media, that's fine. At least you know. And actually, you can let the patient feel really safe by telling them when you take all these photos that we're going to go through, that these pictures are not going to go anywhere. You're not going to show them to anyone, and that's nice for the patient as well. So that every step they're feeling really comfortable in your chair. So take a photo of this slide, if you like, guys, of this pro forma here. You can type it out and you can use it in your practice as well to get your photo consents from your patients. Okay, if you've got that picture, let's go through the images. So why all these images? So let's have a look at that. So first of all, the full face image, full face, not smiling. Really important image to take for dentistry and for facial aesthetics. You want to see what the patient looks like at rest. For dentistry, you want to see if there's facial asymmetries that you need to know about. And if they are, then maybe that's dental related. And so that's something that you then want to keep in mind for your dental plan. If there's a crossbite or something that's influencing the way the face looks, then that's something to explain to the patient why it's even more important that that's treated from an aesthetic perspective. Also, just having a look here with this patient here, her concern was her downturned smile. We can also see with face at rest that her eyebrows are uneven. So we could look at correcting that for her with some injectables. She didn't notice that her eyebrows were uneven until I pointed it out. And so that's always a tricky thing as well, that, when you go through the photos, you want to say, just to let you know, your eyebrows aren't perfectly even. It's not detracting from your beauty. Because if they haven't mentioned it, then it's not detracting from their beauty for them. Then it's not detracting from their beauty. As long as your patient feels beautiful, if your patient feels attractive, your patient feels handsome, then that's all that matters. That's really where the true beauty comes from, and that's what we're trying to achieve here. We're trying to help our patients be in a place where they feel really comfortable with the way that they look. We also take 3/4 views, so either side, and that helps. Here we can look at, for facial aesthetics, we can look at jowls, we can see lines at rest, or crow's feet if there's anything there, lines on the face. We can have some idea about cheekbone contour, start looking at the facial profile and how the nose lines up with the lips and the chin. Any bump in the nose. So all of this is really interesting to start looking at various treatment options for this patient. You can also see with her neck, the lines that she's got on her neck, and potentially you could give treatment options like that. So there's lots of different things that we could offer this patient depending on how far she wanted to go or what she wanted to work on. And then similarly, the profile view is really important. You can have a look at the jawline, you can have a look at the cheekbone structure, you can see the nose, you can see how her classification is lining up. And so, yeah, again, a really, really useful image. And then for facial aesthetics, we want to get dynamic views. So we've got her frowning here. We've got her lifting her eyebrows up so that she's using her frontalis and we can see what the lines are like there. And we've got a full smile. And quite often for these images, I'll take photos, but I'll also take videos, especially if the patient is given consent for social media. It's a really great video to show before and after of the actual movement, because perhaps you won't look very different at rest treating these 3 areas, because she wasn't someone that had lines in these areas at rest anyway. It was just really in dynamic movement. And so it's interesting to show that when we treat those in a before and after, we can soften those lines without paralyzing movement altogether. That's the other thing, people are nervous about. Aesthetics has got a bad reputation. I think we're working on that, but from celebrities where they've had bad work in the past. Cosmetic dentistry can have a bad reputation. Porcelain veneers can have a bad reputation. They think you're cutting teeth down to pegs. They think you're going to look like you're sticking white chiclets on their teeth. They think it's going to look unnatural. And the same thing with injectables. There's some really, let's not mention names, like I don't know, Donatella Versace, Sylvester Stallone, really big names who've probably been to really great surgeons, but their treatment doesn't look great. It looks overdone. And so then people worry that that's what they will look like. So you want to show them that done in a really subtle, beautiful way, these treatments can give you a lovely result without making you look strange or stopping you from being able to move your face. this smile shot is useful for your dental view also. It's something that the face at rest and the smile are images that I take for my dental views anyway. So within the dental views, you want a patient to smile, so you can see how much tooth display they have at their normal, comfortable smile. You want face at rest, so you can see what the face looks like at rest, and we've gone through those two images. But you also want a full smile with the patient at full, you know, that's great for facial aesthetics to see which lines come out at that stage, but also it's great for dentistry because you can't, if you fix just what's showing on their selfie smile, on their social smile, and then, you know, one day they're really happy and they're laughing and smiling, and someone takes a picture, and then they realize that their work doesn't look so great at that smile, then you've only done half a job. So it's really important to say to the patient to get that social smile, but also to get their full smile, and also to capture both, so that when you're creating your treatment plan, when you're going back through these images later, you can have a look at those. Here's some closer shots. So then I go from the full face into the mouth. I do a big smile up close, and then 3/4 smile view. So just like we did with the full face, but now with the mouth. And then I do retracted view. So I pop my cheek retractors in. I get the patient to bite together. I get the patient to open slightly, so you can really see where all those gingival zeniths are. You can see the wear on the teeth. You can see the crowding. You want to do the same thing on a 3/4 view, so biting together and open slightly on both sides. So I do that side and then the other. And then I get a close-up view so that I can really see the nuances there of what's going on with her smile, the different colors, the different shades, if there's fluorosis, the patterns, if there's wear, the patterns. And also it's a good idea to take occlusal shots as well. So that's your consultation records gathered at this stage. That's as many records as you need. The conversation that you've had has got an idea. You've got an idea about what the patient wants, what their history is like. You've started formulating some sort of plan in your head. You've then done your dental examination in the patient's mouth, and you've gathered all your information there. You've taken X-rays if you need to take those, and then you've taken your full series of photography. Now, before you start creating a treatment plan with the patient, it's really important to take the patient's personality into account. It will be a big part of the treatment plan that you create. And that's why it's really not a one size fits all. You can't take an image like this one here and create a plan. Firstly, you have no idea how much tooth they're showing on smiling. You know, you could create this whole plan about, oh, her gums look higher on the left than they are on the right, and we should do gum surgery and do this, that, and the other. And then actually when she smiles, even at full smile, she doesn't show her gingival zenith, she doesn't show her gum margin. So why are you adding gum surgery for a patient that never shows that? And so yeah, so you want to create your plan according to who the patient is and what they're looking to achieve. Are they looking for quite large lips like this lady here? I didn't do her lips, she had them done elsewhere, and actually I said it would be nice to dissolve them and change the shape of them slightly. And once I did her veneer work, I did some veneers for her. You can have a look at the case on my Instagram page. So yeah, let's start trying to understand like who this patient is and what they're trying to achieve according to their personality. So it's always facially driven dental design and personality driven full face design. Like, you know, you're looking at, do they want something very natural? Do they want something very Hollywood? Do they want something over the top? You know, do they want some imperfection still, like just to look better but not look absolutely perfect? And these things are really important, and that's what differentiates you from other clinicians. That's because you care and because you take that into account. So the patient's personality, this is a really important aspect, and something that you should tell your patients that you're looking to take into account, that you're not just being that scientist and saying bang, 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 yeah, let's do this, one size fits all. You want to understand who they are and what would be best for them. So, you know, you have a patient I had to use Katie Price as an example. She was the first person that came to mind to me with a sort of very glamour model type look. So, you know, a patient comes in with this sort of glamorous look, glamour model look, and says, oh, I want to get my teeth done, but I want something that's really, really natural. I don't want anyone to know I've had my teeth done. I just want them to look great, but look really natural. And so you're kind of looking at them and thinking, okay, well, you look like you probably want a little bit more than natural. Like want to look, you're a little bit showy. You'd want the smile to be a bit showy, but you're telling me that you want absolutely natural. So I always ask my patients to show me examples of faces, of smiles that they like. I know that there's a really differing view about this. And like you'll talk to hairdressers, and hairdressers will be like, oh, they'll bring me a picture of this person, and there's no way I can make them look like that because they don't look like that. Or dentists will be like, oh, they'll bring me a picture of Julia Roberts, and she's not Julia Roberts. So how's she going to look like that? I disagree with that. I think if your patient can give you examples of what they like, then it'll give you a better idea about what they're looking to achieve, more so sometimes than what they're saying, the words they're using. So looking at their actions rather than their words. So for example, recently I had this very glamorous patient come in who said the same thing, I want this really natural smile. And then this is an actual example of the picture that she sent me. I said, okay, great, send me some pictures of what you like. And she sent me this. And so I was like, oh, okay, so you want a really natural result like this. Obviously, this isn't a really natural looking smile. It is to me, it's blocky, it's white, it's chiclet teeth. It's the opposite of a natural smile. But it told me what this patient was looking for. She was looking for that. She thinks this is natural, but it's not. And so you start getting more of an idea about your patient. This is really an information gathering exercise, this aesthetic consultation. There's a lot of information we need to gather. You really need to read between the lines and understand your patients so that you can really deliver to a high level. And so your patient will love the work that you do, so that you don't have any problems after, so they will rave about you to their friends, and it's all win-win-win. We all want to do a great job. And the easiest way to do that is by really understanding what it is that our patients hope to achieve. I found this image and I was like, okay, you have a guy comes in like this saying, yeah, you start creating an idea about what it is, the sort of treatments that he may be looking for by the way that he looks. So he's chosen to wear a bracelet. He's chosen to wear a tight printed shirt. Like maybe he's quite showy. It's not over the top. Probably what he's looking to achieve is very masculine. You're looking at jawlines. He probably wants to go pretty bold with that. If you're looking at teeth, you're looking at quite blocky, squared off teeth, blocky, broad smile. You can go reasonably light with it. So you start getting an idea about the features that you're going to create according to the way that the patient comes across, the way the patient presents themselves, the way they dress, what they choose to wear. So it's really like being a detective and noting all these things about them, which will help you better understand what it is that will suit them best. Because obviously within all these treatments, there's so many different ways you can go with it. Okay, fine, you're going to define someone's jaw. Are you going to define it by just giving them a very delicate jawline? Are you going to give them a really big angle of the mandible? How far are you going to go with that? And so for every individual treatment, there's really different ways it can be done. And so you need to understand for that patient what's going to be the right choice. I think for a patient like this who comes in, looks very natural, hasn't maybe got a lot of makeup on, you can see that she's got her crow's feet by her eyes. She smiles really big. Maybe she doesn't show you this smile. Maybe you need to make some jokes and get her laughing so you can see that gummy smile. Patients with gummy smiles get quite good at hiding them because we're very good at human beings of kind of realizing what our strong points are, what our good points are just subconsciously. The amount of times you try and take that full face image of a patient with them looking straight at you and they turn their head slightly to the side, and it's because there's something on this side that they like better. Maybe they've got a mole on that side, maybe they've got crowded teeth on this side, and so automatically they do that. So just subconsciously as human beings, we're good at hiding the things that we don't love about ourselves. Gummy smile patients are good at hiding their gummy smile until you really make them laugh, and then they can't help it because that's how their face is set up. So you want to incorporate in your treatment plan a treatment plan that's going to work for someone like this, someone who wants to still look quite natural, someone who likes to smile and you don't want to stop her smiling, but maybe you don't want her lip to lift quite as much up when she smiles. And that's all a discussion that's worth having. And then, I don't know, I thought this image was interesting because, you know, this guy's come in, he's done his hair, he's got his stubble. What's he looking for? He could be quite quirky. He could be looking for something. He's very angular in his face. Is it natural? Has it been placed into his face with his teeth? I know, like, you know, patients ask for unusual things. Sometimes I had a patient once who asked me to give him like vampire type canines with his veneers. Obviously I was like, well, we've got issues with lateral excursions that need to be taken into account, and there's various things that you need to think about, and also the medical legal side of it, that you really want informed consent. If you're going to do something a little bit out there for the patient, that they've understood that that's what you're doing, and they're not going to come back later and you have to argue the point about why you gave them something out of the norm. So yeah, lots of different things to consider and think about, trying to understand who your patient really is. And then finally, you know, this lady here, she looks like she's you know, she tells you that she's running her own company. She's a busy professional lady. She's a beautiful lady. You know, what are we trying to achieve here? Do we want to, I'm sure we want to give her like a very natural, beautiful smile. So very perfect without it being fake. So just naturally perfect. So it looks like she was born like it. And I would assume, you know, looking at her and the way that she's portraying herself, it's amazing how much a photo can tell you about a person. It's amazing how much we can learn from a person just by their face. It's amazing how much we pick up within just talking to a person for a few minutes about who they are, compared to all the other people in the world. And that's who we need to be as the estheticians. We really need to be readers of people and really understand our clients and who they are, and to give them a comprehensive plan that's going to work really well for them. So now we pop the photos up on screen that we took, that full series of photos, and go through them step by step with your client, explaining what you can see, explaining what can be done, always going back to the initial issues that the patient came in with. So you're reminding them that you're not just going off on your own plan. And, you know, they love to complain about dentists or estheticians saying, oh, they just wanted to make money, and they just wanted to, you know, you want to be, you know, this is not about money. This is about giving the patient the best plan possible, but also sharing your expertise with them. So go back to, you know, this is what bothered you. This is what we can do about it. There's also this, I'm just letting you know because that's my job and you've come to me. You know, we're going to use this as a shopping list. Aesthetic treatments never need to be done. They're always done because a patient wants them. And I think that's really important. The treatments that they're having should be like a shopping list. If you want to do it, you do it. If you don't want to do it, don't do it. There's no compulsion. It's just something fun in life that if they want to, then you can be the person that can help them with that. And so you're going to create this plan. You're going to create this really comprehensive plan, which is an aesthetic plan for their teeth, an aesthetic plan for their skin, an aesthetic plan for their face. So it's a lot to go through. You need a lot of time for this consultation. You may want to allow an hour and a half for it. Maybe initially, if a patient comes in, you know, say you're in general practice, and then a patient expresses an interest in aesthetics, then you would rebook the patient for this hour and a half so that you've really got time to create this plan with them. And then obviously once this comprehensive plan is made, you can just bang, bang, bang through and you can work through it. But this really takes time to go through everything in detail, make sure the patient understands their options, and make sure you've gathered all your information. So you're going to work through systematically, keeping all the variables in mind, keeping in mind all the options that are there, keeping in mind potentially the patient's budget, the patient's expectations. Don't give them the face that you want to give them the face that they want. So there's lots of different things to think about. So I'm going to go through one of my cases with you so that you can have an idea about how this would work actually in practice. So this lovely patient came to see me last year. She came to see me. I did an online consultation for her in the first lockdown. So in March, and so she came to me with this image on your left. And this is how she left me at the start of the next lockdown. So you can see there's a world of difference. She's just a better version of herself. And we just worked through systematically, trying to work out bit by bit what was going on there, what her concerns were, and how I could help her to help her look fresher and, you know, be more confident in the way that she looked without looking done up, but just by looking like a better version of herself. So obviously, this is her before. These are the images that we need to take. So we start off with a full face image, looking at her at rest. She has a few lines in her glabella area and also on her forehead. She has a slightly downturned smile. She has a little bit of volume loss in her face. She has quite developed masseters on the side of her face. And the skin doesn't look great. Like it looks like it could do with a little bit of a wake up and a stimulation. And then in the smile image, we can start to see that the teeth are very worn at the front. So that fits in with these overdeveloped masseters that she's got on the side of her face. Her crow's feet aren't too bad, to be fair. The color of the teeth aren't as white as the white of her eyes. She could do with rebuilding her smile. You know, her front teeth are very short. We'll look at a close-up picture of that. We start looking at dynamic movement. You can see that sort of strong frown line there. You can see that on frowning, the left eyebrow goes lower than the right eyebrow. Then let's go back to having a look at rest. Actually at rest, the left eyebrow is a little bit lower than the right eyebrow. So that could be something that we want to address in how we do our injectables. We can have a look at lateral images. So have a look, her crow's feet aren't too bad. And we can look at her facial profile there. Have a look at her eyebrows lifted. The right eyebrow lifts higher than the left. She has quite significant lines on her forehead on lifting. So that's definitely something that would be nice to soften. So yeah, and then from there we can start creating a facial plan. Also taking into mind the conversation that you've had before about what she was doing already. She wasn't using any medical grade skincare. She didn't have any previous experience with injectables. With the teeth, obviously her mouth was healthy, but the teeth are massively worn. She's got a very low smile line. So we're not going to worry about the position of her gums, of her gingival zeniths, because you can't see them. She has got a midline diastema. Does that bother her? Would she like to keep it? Would she be open to closing it? That's a discussion to have, because absolutely, you know, it can go either way. In this patient, we decided to close it. The teeth are very, very worn. She's eaten away nearly a third of her upper anterior teeth. The lower teeth are very worn. You can see her dentine showing through on the edges of her teeth. So yeah, this is a great case. It's going to look great to restore all of that. The lower anteriors are also crowded, and so I know straight away that I want to build them up. I'm going to dial them, like build them up and use the dial principle to put them back in place. But first of all, it would be nice to straighten them. So I'm starting to create a treatment plan in my head. We take lateral views. It's important to have a look at lateral views. Here you can see that side is all closed up. This side you can see there's a bit of a gap behind the canine that would look nice to close on a lateral view. Retracted views, also really important. Like we said, the gum margins aren't very important to us because she doesn't show them on smiling, but good to see here, looking at gum health, looking at positioning, looking at wear, seeing how far back it goes. We can see she very much likes to grind on her front teeth as opposed to her back teeth. That tells me she has a prematurity in her back, on her back teeth. Have a look at, on my Instagram, there's under the IGTV, there's something called an Occlusion Live. And there I explain about this. It's like a 15-minute video explaining about why patients come and start grinding away at their front teeth and what we can do about that. So rather than doing that right now, it's a whole new topic. You can check that out there on Dr. Manrina Rhode on Instagram, Dr. Manrina Rhode. And then you can have a look at lateral views on either side. And then you can start creating a treatment plan. So for this patient with her teeth, let's go to something like this. So that's a nice view to create a plan with. So we decided to whiten everything. We can see that she's got some fluorosis spots there. So we talked about potentially using Icon as well to help with fluorosis. We decided to restore the top teeth in porcelain veneer. So we decided to do 8 of those because that's pretty much what shows when she smiles, and that's where her wear is. And at the lower, we decided to do a brace. And then once they're straight, to build the teeth up with composite bonding, and then to put her in a deprogrammer and equilibrate her bite to put her into centric so that she doesn't break these beautiful build-up that I'm giving her at the front. The fluorosis was mainly visible on the upper teeth, so we decided not to icon the lowers, and whitening was enough. So so in the end, we decided 8 upper ceramics, lower whitening, brace, and anterior bonding, 3 to 3. NTI appliance and deprogramming to sort out her wear, put her in a night guard. And then for the face, we decided to do injectables around the forehead area to try and even out her eyebrows and try and soften this line here. Also, we decided to get her on skincare, which would help to rejuvenate the lines that she's got on her face. We decided to do masseter, Botox to bring in her face for facial slimming, but also to help with her teeth. Like, more important than anything, she needed that medically because she's eating away her teeth. So getting rid of her masseters, like toning them down, not getting rid of them, getting rid of the bulk from them, will give really nice aesthetic benefits, because this is making her look quite sort of angry or chipmunky, but really great also for the health of her teeth. We decided to do cheek fillers to lift the face, and we decided to do a little bit of lip filler, but just a slight hydration, not too much, because she doesn't want to look glamour modelly in any way. She's an important business lady, and she wants to just freshen up the way that she looks. Because when I spoke to her, we were on Zoom because the clinics weren't open at the time. We started off with skincare, and skincare is a great place to start anyway. She was just using generic over-the-counter skincare wherever she could get hold of. I actually put her on my skincare, on DRMR skincare. So we had her on bringing out the holy grail of skincare. So the holy grail is a vitamin C, a medical grade vitamin C, using a daily SPF. I've got an SPF 50, and then using a retinol. And retinol, you never want to use it without also using an SPF. And I mean, the whole skincare lecture is, again, a whole separate hours lecture, but just by moving her over to my cleanser, so that she had a good quality cleanser, non-anti-inflammatory, antibacterial, to be cleaning out her skin twice a day. Straight after that, in the morning, she used my Radiance. It's a 10% vitamin C. It's tightening, brightening, evens out skin tone. After that, she uses my Defense, which is my daily moisturizer with SPF 50. It doesn't make your skin white and pasty. It gives your skin a lovely glow, and it will start to help with the sun damage on her skin. She uses my eye cream, Firm, just half a pump around her eyes, and it just gives you a brightening and a filling effect of the eyes. It's got hyaluronic acid in it, and also helps with preventing fine lines and wrinkles moving forward. And then started her on my lip oil hydrate, so that we could prep the teeth before her lip fillers to be promoting their own collagen, and also encourage exfoliation so she doesn't get dry, chapped lips. And then at night time, she started washing with my DRMR Face Wash Clarity, and then using Renewal, which is a 1% liposomal retinol. I mean, retinol is the holy grail of anti-aging skincare. There's like 30 years of research behind it. The way it works is it targets the fibroblasts of the skin, so the lowest layer of the skin. And when we're younger, in our 20s, these fibroblasts are like pumping out. So they're pumping out collagen, hyaluronic acid, elastin, like all the goodies that you need to have beautiful full skin. And then sort of it's mid-30s, you know, it just starts slowing down, and by our 40s, it's slow and it's irregular in its pumping. So by using a vitamin A product, a medical grade retinol, you can buy over-the-counter ones. Over-the-counter retinols are never going to be strong enough to really have an effect on a cellular level, because when there's an effect on the cellular level, you can also have downtime. So you can initially have some peeling or some purging, and you can imagine that over-the-counter medications can't supply anything of that strength, because imagine the reviews like, oh, I bought this product from so and so, and now I've got all these repercussions. So it needs to be through a clinician, and so it's clinician-led skincare that you will find will really help, and you'll see how much it helped her and how beautiful she looked after she started that. So she ordered all my skincare, and she started using that in lockdown. So by the time she actually came in to see me, her skin was already much better. And so we can already see here actually that when I took the photos, her skin was already looking fresher. And then we made a treatment plan incorporating her injectables and her dental treatment, because it was a process with her dentistry, especially with the lower brace, to work through. And so I gave her a treatment plan, not a separate treatment plan, one treatment plan, because it's one face, saying at this appointment we'll do this. We'll start off with your Botox and set off for your smile makeover, and we'll do your whitening. Then we'll do the smile makeover. Then at the end of you'll have your lower brace, and we can, after while you've got your brace on, we can put in your lip fillers, and so then I can review them while you're in your brace, and then we end up with anterior bonding, and then we equilibrate. So it's creating a comprehensive plan. Every appointment, length of every appointment, cost of every appointment. So this is a long consultation. It's an hour and a half, but at the end of it, this patient's got their next like 4 or 5 months plan mapped out for them. They know the total cost of it, and then they can just book in and start working through, which is really fun. And then you kind of end up with your beautiful before and after results. So yeah, I think you will all agree that she looks lovely afterwards. It's still very fresh. She looks very fresh. It's still very her. I don't think she necessarily looks like she's had anything done, but just a better version of herself. And that's what we can achieve for our patients. So thanks, guys. Thanks for listening to me for the last hour, just almost an hour. I hope it was useful. Like I said before, if you have any questions, then just get hold of me on my Instagram page. I'd be more than happy to answer them for you. And that's it. Have a lovely day.